I'm honored to be joined today by Karen Joash. To many of you who've joined here and many of people who know her, she needs no introduction, but I'd like to introduce her in a slightly different way. All right, so because when we talk about careers, a career like Karen, it's easy to listen to her achievements. You know, over 15 years of experience, a leader in obstetrics and gynecology, head of school in postgraduate training in London, and a driving force behind quality, safety, and perinatal mental health at Imperial. And yet what defines Karen is not just her expertise, it's how she shows up for her patients. She's calm, she shows up with clarity, and with a deeply human understanding of what this work really means. And on a personal note, I think one of the greatest strokes of luck in my career was training under Karen. First as her SHO and then as a registrar. She was and still is everything I aspire to be. She is unapologetically ambitious, unwaveringly composed, and quietly formidable. And what perhaps is less visible, but just as defining, is the breadth of how Karen thinks about women's health. So alongside her clinical work, she holds an MBA, she has training in functional medicine, and has founded an acclaimed supplement brand, all reflecting a commitment to looking beyond the traditional models of care and how we can do better and we can show up better for our patients more holistically. So today, we are not just hearing from an expert, we are hearing from someone who embodies what it means to lead, to care, to innovate, and to keep learning in a field where the stakes are so profoundly human. So Karen, it's an absolute pleasure to have you with us today.
Oh, I'm so honoured, Shirin. Thank you so much for having me.
Thank you for joining us. So I'm sure you've all seen the title of our series, and I am Shirin Khanjani. I'm one of the consultants here at Fitzrovia Fertility. I'm one of the founders, and here at Fitzrovia you will know that we have a real passion about being holistic in what we look after for our patients. So we are today talking about the preconception phase, right? What it is before it all begins, and how do we look after the woman before it all starts. So we know that the periconceptional period is critical for the conception, for the pregnancy outcome, also for the long-term health of the pregnancy. Sorry, our clicker is a little bit slow. So the core question is, what improves pregnancy outcomes before trying to conceive or before you start IVF? And the honest answer is, some things clearly matter, some things probably help, and some things are given far more importance than evidence actually suggests. What I really like is this diagram. It is from a review published by the authors here that I've copied in. So I'm going to stand up, sorry. I need to have a look at my slides. So here you can see that diet and supplementation here is important. And we've got some supplements here that have given some value, but I'm really looking forward to hearing what Karen thinks about these. Environment is obviously critical. We all know that we are increasingly living in a world that has got more toxins that we like it to have. So there are heavy metals, there's lead, there's pollutants, there's radiation, and we need to make sure we reduce exposure. Okay. There is mental health, which is incredibly important in preconception. And again, we need to decrease the stress. We need to address any outside interference. And we have good control of mental health disorders if there is an underlying condition. Physical activity, huge amount of evidence. Dental care is really important. There's evidence of if you have infection in and around the gum, that can trigger miscarriage or preterm labor. Obesity, I don't need to tell you, there's a lot of evidence about obesity impacting pregnancy outcome. If people have pre-existing medical conditions, then we definitely need to refer them in my sort of line of work to experts like Karen, so they can change the medication to medication that are safe for pregnancy. Substance use, obviously caffeine, we say 1 cup a day, less than 200 milligrams, and there has to be cessation of alcohol, tobacco, and any illicit drugs. And obviously any chronic conditions such as diabetes needs to be managed. We are obviously very lucky living in the UK. We are almost all up to date with our vaccinations, but that's also something that shouldn't be forgotten. For me, in my line of work as a fertility specialist, I have a bit of a challenge, and that is optimization versus time. All right, so there are some factors that are modifiable, right, such as smoking, weight, metabolic health, diet, supplements, pre-existing medical conditions. And yet, there is one factor that we cannot modify, and that is reproductive aging and time. So this all needs to be in balance between optimizing preconception health and yet being mindful of time. And we are all familiar with female fertility timeline and decline, and we've seen it in various different forms. But this, I think, is quite stark, where you know that actually, biologically, the optimal time for reproduction is between 18 and 24. That is not in line with our current lifestyles, right? And when you hit the 36 and above, you can see fertility declines drastically. So when do we optimize, and when do we go, time is of the essence, and therefore we need to be much more targeted? So again, what is really important, and I'm not going to spend much time on this because we had in our last Fertility in Focus series, Dr. Pippa Sangster, who's an andrologist, and we talked about male fertility being contributory to about 50 to 80% cases of infertility. So we have to be careful to approach this as a couple-based model. And fertility and early pregnancy outcomes are influenced by both partners and by their shared lifestyles, usually, and the environment that they share. So what actually falls under optimization? General health, right? So diet, weight management, alcohol, smoking cessation, and sleep are really important under optimization. Medical and metabolic factors, like we discussed, such as thyroid function. You know, all our patients will know that we do a thyroid test for most patients that start with us. It's important. Diabetes risk, overall health, risks of anemia, again, really important. And supplementation. So there's often a lot of confusion about supplements. Again, I'm really looking forward to hearing Karen's perspective on that. And assessment and timing. So when to investigate, when to reassure, and when to escalate and consider treatment. I just want to bring your attention, there are lots and lots of studies, and I'm not quoting them because I'm really mindful that we have clinicians and patients on this seminar. So I don't want to overwhelm you with a lot of studies, but everything I presented so far, things like smoking, things like weight loss management, things like having a good diet, reduced caffeine intake, supplements such as folic acid and vitamin D have a lot of evidence behind them. There are lots and lots of studies that support them. I'm just bringing this study to your attention, which is hot off the press. It was published on March 24th, 2026, which is yesterday, in Human Reproduction. And it's one of the first of its kind that looks at shared diets of both partners. And it has shown that ultra-processed food consumption in the preconception phase in both women and men impacts the growth of the embryo as well as the chances of fertility. So there is more emerging evidence about the diet and exercise, and there is more research looking at a couple-based model as opposed to just looking at what the woman consumes and does. Genetic screening and carrier match is something I feel passionate about. We offer this at Fitzrovia Fertility. So in this diagram, you'll see most people are carriers of at least one genetic condition. So all of us carry genes that, if we put together with a partner that has the same gene, can result in an affected child. So the preconception phase is a really good phase to sort of look at these as well. It's a genetic test. Most people carry one gene, usually without knowing it, and we can do carrier screening to identify whether a couple have a shared risk of passing on a condition. Again, where I sit, it's really important to also manage expectations. So I think pre-pregnancy optimization can improvement the conditions in which conception and early pregnancy occur. But what it can't do is fundamentally change certain things. So it can't fundamentally change a woman's ovarian reserve or fundamentally change the quality of aging eggs. And it is really important to be honest about that. Because again, we have that predicament of time and also being honest and real and manage patients' expectations. So the aim is not perfection. It is to put people in the best possible position without creating unnecessary delay or anxiety. And on that note, just setting the scene, I'm going to pass this over to Karen, who will tell us all about everything I sort of introduced in a lot more detail.
What an excellent sort of start to the seminar. And I must say, I very much, really respect and believe in you, Shirin. I've sent some really difficult patients to Shirin over time, who she's managed to get pregnant, who have been through cycles with lots of different people, they've lost babies, and you have made dreams come true. And I just want to just recognise your heart and that all you do for these women. You're doing a fantastic job. And so, interestingly, I love this whole area of pre-pregnancy optimization, because I think it's an area that when we really look introspectively at ourselves as doctors, I just don't think we do enough research on it. We say the evidence isn't out there, but that lovely scientific study you showed about ultra-processed food, it just makes perfect sense. We know there's a problem with the gut. So, of course, if somebody's going through fertility and having lots of processed food, it's going to determine and have an impact. And that's part of my passion. I've really been spending time looking and putting things together. And just as Shirin has said, we haven't actually seen each other's slides, but we're very similar that in the way that we have said. Fertility is a probability and it's not a certainty, but the shift is we're moving from just thinking about what your fertility is at a point in time, but thinking about where are we at now and how can we optimize the outcome. We know that we're all born with millions of eggs, and by the time you get to puberty, only 300,000 and less than 1,000 at menopause. And we know, as she's shown us in that lovely diagram, that starts to decline from the age of 35. But I just want to introduce to you some concepts of why it declines, because we just talk about it declining. So it's affected by mitochondrial dysfunction. Mitochondria, the energy powerhouse of the cell, they basically fuel your engine, make everything work well, all the way from division, that's when you're producing the eggs, into thinking about also just providing the energy. DNA damage accumulation, and that's just basically part of the process of aging. All of us undergo through that because of the environment that we're in. And oxidative stress. So all of us get challenged by something in the environment called free radicals, and they basically challenge our cells, and some cells get damaged, and we have to work out within our bodies how to repair those. And then vascular and stromal aging, so cardiovascular type aging, and within the cell fluid as well. So if we look at reproductive longevity, you have to understand that for people who come into the arena of having issues with fertility, is it actually a signal in other parts of their body that there's a system that needs optimization? So I know now we're here thinking about fertility, but if you're thinking about early menopause, we know it's linked to cardiovascular disease, osteoporosis, cognitive decline. But this actually reflects what we've said before, that there's an underlying process happening in the body. And can we use that information to just pivot and think differently about our fertility? Doesn't appear, I don't think some of the images have come up on the slides, but for example, when you look at metabolic, we're thinking about people, as you described, the insulin resistance, and we know that accelerates ovarian aging, and we will see that in people perhaps with PCOS. If we look at increased BMI, increased adipose tissue, that disrupts the hormones because of the additional estrogen that people often develop. And then when we look at nutritional deficiencies, which are really rife now, I would say, within our population, we always used to say, eat a good meal and you'll be fine. But now we know our food is so processed. We've basically created chain food to make it convenient for ourselves. That is not nutritional to our bodies anymore. So deficiencies such as choline are really high, iron deficiencies are high, B12 deficiencies are high as well. And the environmental, as you described, I worked with an organisation, we looked at air pollution in pregnancy. I believe it's one of the causes and drivers of male infertility as well as endocrine disruptors, the things we spray on ourselves that disrupt our systems, and of course psychophysiological stress as well, because of the environment we live in, and sleep disruption that can lead to hormonal dysregulation as well. So again, reproductive longevity is not just about fertility. So seeing a fertility specialist and thinking about getting your AMH measured and understand your fertility is a signal, particularly if it's reducing down. And we've got an opportunity at this point to act. You know, time is not always within our gift, but there's what I call a precision prevention window, where you can think about your ovary, think beyond the ovaries and think about how do I prevent system-wide aging biology. So we look at men, men produce sperm continuously, but the quality declines with age. And that again is to do with aging and the environmental effects. And again, they have key changes. I know men think they can go on forever, not get married, not find your partner. But look at this, key ages from 35 to 40, just like women. So you get increase in what we call DNA fragmentation, decrease in motility and morphology of the sperm, and mitochondria. They are there again. And then the testosterone also declines about 1% per year. So just again, we're looking at couple based, and I put the men first because we're always talking about the women, but it's often overestimated. You see a man there with glasses on, he's looking great, everybody thinks, yeah, he'll be absolutely fine. But 50%, and as Shirin said in the last talk, 50 to 80% is actually male factor infertility. And I'm not actually surprised because women are very conscious, maybe we're a bit more conscious about our wrinkles, but it means we think maybe a little bit more about our health in terms of our health practices. But with men, linked to miscarriage, autism, neurodevelopmental disorders, new mutations, changes in the gene structure, as well as you can see what happens within the sperm. So again, you then see all this fragmentation and the mitochondrial dysfunction. And just imagine sperm, they need energy because they move, aren't they? They're very motile. They need that mitochondria to be working efficiently. If it's not, then you've got the energy failure, reduced motility. So it's really good to think of it at that cellular level. So sperm, I think, is one of the most sensitive biomarkers of aging or a problem within a man, and acts as also an early warning for cardiometabolic dysfunction and oxidative stress burden as well. Let's see if that'll move over. And so we've got the critical window, and when we're looking at the window, fertility is not decided at the moment of conception. It's with the egg development, which occurs about 3 months before conception, and also sperm development 70 to 90 days. So implantation and also placentation, which is in the first trimester, also really important. So you're thinking about 3 months before conception and 3 months afterwards. And this is where we should be really biologically active and think about what we can do to help us. So the issue as well that a lot of people don't realise is that in this phase, when you're creating that cell, which is the sperm, or the cell that's the ovary, it will define what your baby becomes, and not just about getting pregnant, but the future health of that baby. It links into implantation, placental formation, fertilization success, and overall the long-term health of the child. So this is our clinical opportunity. This is where we can influence the gametes before they meet. We can influence our outcomes from trying to get pregnant naturally, IVF outcomes, you know, imagine getting like a good yield of eggs of really high quality. So we're not just preparing for a pregnancy test, we are preparing and making sure we've got the biology that means that pregnancy succeeds and that baby is the best that it can be. So it's the couple-based life model that we talked about already. It's everybody coming together. It's the man and the woman. So what have I found? So we've mentioned these 5 areas, so hold them in your mind as we go through them. So that just seems to be a quick repeat. So mitochondria. So remember, energy powerhouse of the cell. In the men, helps with the sperm motility, but also other factors. And then also, if you look at the eggs in a woman, they are also the highest mitochondrial density in the body, and they are the powerhouse of the cell. So one quick thing that you should understand about mitochondria, I learned about this recently, unfortunately I had to have like intensive antibiotics for an infection, is that they are very similar to bacteria in their function. So even simple antibiotics can alter the way a mitochondria works. And so really important to think about how do we then reduce the impact of a mitochondria, so we reduce things like the chromosomal issues and also damage within them. Environmental impacts is the other one which we've mentioned as well. I really love the Yucca app. I'll just post out to you to scan and check your just common household cleaning products can be really damaging to some of our hormones and really affect everything. And I call it the triple hit model, where you get the environmental impact, which leads to stress on those cells and leads to mitochondrial damage. So I keep coming back to mitochondria here, don't I? So I feel they're really important. So overall, it will lead to reduced egg quality, reduced sperm quality, and then unfortunately increased miscarriage and also poor embryo development. Let's see if the clicker's working. Yep, there we go. So that's just another. So I just want to go back to this slide. So this is the first supplement I'm giving you to think about. So glutathione is produced at the cellular level and it helps to reduce the oxidative stress and the damage that occurs every day. One of the supplements that you'll see me mention in a minute is NAC. NAC produces glutathione within the body or increases levels of it, or you can take glutathione as a supplement, but it's sometimes very difficult to stabilize within supplement preparations. I think my slides are slightly off, but that's okay. And then the other thing as well is thinking about the microbiome. So microbiome is actually affected by things such as even air pollution. So people say, I live in a great air pollution area, it's not affecting me, but it gets into the water. So therefore it goes onto the fruit and the vegetables, disrupts the overall microbiome, causes what we call a dysbiosis. That can be within seminal fluid, it can be within the ovarian, sort of pelvic area, it causes inflammation and fertility impact. And there we've got, as we said, you already said about processed foods. Plastics, again, another big problem. And then just general stress can affect your microbiome and lead to metabolic dysfunction. So again, you've got another slide that just summarizes this and adds in the whole layer of chronic inflammation. So remember the mitochondria, the microbiome, and now we've got chronic inflammation. And this can lead to implantation failure. So really important to think, how do you protect this upstream? So everybody just thinks about the gut. I know there's lots of popular podcasts on, but it's not just the gut when you're thinking about the microbiome. You're thinking about all areas of the body that can affect everything, including things like PCOS, your estrogen balance, the way that we have certain bacteria which help to metabolize some of the things which are really important for our estrogen function and influence circulating hormone levels. So the gut is important in regulating your estrogen metabolism. Again, the gut-sperm axis, we know that the microbiome can lead to sperm fragmentation, and some of the mechanisms are through the short-chain fatty acids, which lead to inflammatory effects and epigenetic effects as well. So just even with the microbiome, probiotic-rich foods can improve the gut-sperm axis. And so the fertility requires immune balance. So if you're thinking about probiotics, it helps to regulate your T cells, and we know that some people get concerns about immune tolerance within fertility, and obviously that some people have to give IV, IG and other things to help affect the T cells. But just think about probiotics for a start. It's really important, it's critical for implantation and also early pregnancy success. So let's go on to now talk about supplements. So what's the foundational approach? So everybody talks about folate. So the clinical evidence is high, but just recognize that when we're talking about a foundational approach, that is not affecting the quality of the embryo. Folate is particularly linking into early pregnancy. So it's talking about neural tube prevention and implantation. Vitamin D, also really, really important. It's really important in implantation about the endometrial receptivity. And we also know that people who've got a vitamin D deficiency more likely to have miscarriages and also reduced implantation. Ferritin is also another big one, and low ferritin is very common in women. Up to about 30% of women will have a low ferritin. And B12, we know, again, there's a recent study that was done looking at women who are pregnant, and we've recognised that there's a really sort of higher chance of miscarriage and fertility problems with B12. And then the one I will put in the middle, which it's one of our hero products within our supplement company, is choline. So really under-recognised. It's really for people who are particularly on plant-based diets tend to be deficient in this. It works with folate and omega in terms of how the neural development and formation of that embryo works, but most people don't supplement in it. It's not in the lot of the big supplement companies. Okay, so that, and then on to thinking a little bit about what we call the functional and cellular. So this is more leaving on to high level supplements. We don't do all these supplements, but in the evidence and search that I did from the nutritional element, it's recognizing that all of these can play a role, and it's important to recognize where is the fertility issue, and then you address it from an individualized basis. So one that is, for example, is ALA, which is alpha lipoic acid. This is a potent antioxidant, and it really works well with mitochondrial cofactors and reduces oxidative stress. So really important for people who've got insulin resistance, PCOS. And I've seen this work really well in patients, for example, who have got pregnant, but have had really low growth with their babies. It helps the placenta to recover. The placenta is a bioenergetic organ, so we need to support the mitochondria within that placenta as well to recover from any genetic or environmental hits. Myo-inositol, which I think is brilliant, it helps for signaling on the ovary for it to release that oocyte, that follicle, and it's a gold standard that many of us know from PCOS. The other one I love now is spermidine. I use that quite a lot in different functional medicine settings as well, but it's really good for stopping a process called autophagy, which is cell death. It improves the mitochondrial turnover, really good for sperm quality and also oocyte rejuvenation as well. It's very good for vascular effects as well. It's emerging, but it has a lot of biological plausibility. Urolithin A, again, which is really good. It improves muscle and mitochondrial health again. So there's a potential there where it can improve the embryo quality and also sperm motility. Remember, we're thinking about the mitochondria for that reason. And then everybody knows about CoQ10. It's the cornerstone, but I must say when I look at a lot of supplement companies, they don't put enough in there. It should be at least a minimum of 200 milligrams, and it's strong evidence for egg quality and IVF outcomes because of the cardiovascular. And then NAC, I mentioned before, it's got a glutathione precursor, which really is important in PCOS and egg quality. And then we have magnesium, which is from the biological element, and then we've also got beetroot with nitrates that improves perfusion. So let's see what we've got next. Yeah, perfect. So what I wanted you to think about is slightly differently, which is that if you've got a problem, you can recognize how to address that problem by looking at exactly what it is by the different interventions. So whether it's egg quality or whether it's sperm quality, these are the foundational ones that everybody gets, but if they've got issues with egg quality or PCOS, you might want to add on myo-inositol. If there's a problem with egg competence and also aging, you might want to add on urolithin and A or NAC or glutathione. Okay, oh, great. Let's see. I think I'm going the wrong way, am I, on that one? So I think it's going back that way. So this is just a picture from our company. Really proud to have won awards for the work that we've been doing, particularly because it's making a difference to, sorry, I'm just trying to go back and forth, to women's outcomes. So here's a summary of the different things that I want you to have a look at. There's quite a lot on that slide, so we can make it available afterwards. But it's thinking, let's go to the men. So if you've got somebody who's got DNA fragmentation, these are the interventions that I would employ. They would have choline, folate, B12 and methylation support. If you've got a woman who's got problems with, for example, in PCOS, I would also layer on a protein-rich diet, low glycemic load. If you've got somebody with a follicular damage and accelerated depletion, you look at antioxidants and really look at that load. So it's really just giving you a table to understand when you should intervene and when you shouldn't. So, sorry, this is not, this is going back the other way. Just making sure it, yeah. Okay, thank you. Maybe the sensitivity of it's not working. Forward. Yeah, forward. Perfect. And then also specifically, so the supplements that work, so people say probiotics don't necessarily work. The reason why they would say it doesn't work is either because you have to think about getting a supplement that's got a prebiotic in it. If you haven't got the right substances that would feed your gut microbiome, you won't get the right bacteria growing, so therefore it's not going to work for you. And these are some of the key strains that we know reduces the inflammation and improves the gut barrier. On to the next one. And so therefore if you've got that gut barrier and you're really thinking about that preconception phase, you'll improve your estrogen balance, reduce oxidative stress, and the vaginal health has lactobacillus dominance. So again, this is the choline that we talked about before. We've won awards because we're the only UK supplement that contains choline in it, and it's targeted within preconception because it supports not just the fertility, but the development that follows. And so this is when you think, I'm just showing you again for choline, it has so many important domains. You've got the methylation, you've got cell membrane integrity, neurotransmitters, lipid metabolism, placental function, as well as the long-term programming of offspring health. So for example, if you're choline replete, we know that it improves the cognitive, memory processing and speed of your child at the age of 1. We know it reduces the risk of cardiovascular and preeclampsia as well because of how it works in the placenta. And then we also know it's really good for sperm quality. And then here's a little bit of genetics I just wanted to introduce you to as well. So you can take all these supplements, but if it's not personalized to you, it's not always effective. We all have the fixed blueprint, as Shirin has talked about, but with the epigenetics, that's how the environment changes the expression of those genes. And this is where we can start to control our biology by the messages we give to those genes, whether it's about our food, nutrition, or even supplements. On to the next one. So I just wanted to bring to you a personalization of a case. So this is a lady who had been with me throughout all her pregnancies, 2 live pregnancies, but she now was on her 4th miscarriage, approaching the age of 40. She'd had PCOS, she was obviously weight optimized, she'd been running marathons, very healthy, taking all the pregnancy vitamins, and then all her recurrent investigations were normal. So we were at a phase where she was just thinking, actually, I'm just going to give up now, what am I going to do? I then actually did a Grow Baby report with her. So Grow Baby is from a company called Nordic VMS. And it can give you really personalized insights. So it talks about, if you look at all the way over here, it talks about your lipid metabolism, your inflammation, detoxification, methylation, all these things that we've been talking about. And it will tell you and give you a nutritional and a supplement and a lifestyle plan. So with her, actually, when we did it, she had hits in almost everything. So it was looking at the genes. So she had a high chance of inflammation. She had really poor detoxification within her own cells. Methylation wasn't good, so she needed methylated folate as well as high choline. Vitamin D wasn't good either. And we instituted this capsule, actually, it's called the O capsule, which combines most of these elements and basically is a one-size-fits-all for people who need it. And we're pleased to say that within 2 months she was pregnant and is still pregnant at the moment. So I've come up with a framework. Some of the slides are not quite showing in the normal way, but this framework really is thinking about for men. So just think about strong sperm. So think about your sperm DNA integrity, temperature, obesity, your nutrients, zinc, selenium, omega-3, CoQ10, choline. And then think about the impact of stress, physical activity. Yes, laptops and things like that are not great in your lap. Recovery, and then think about your medications. And on to the next one, please. This is just our website, and you can use the QR code to explore the full range. You can also follow us at Pura Mama. And then this is a women's one that is really prepare. So thinking about your hormones, your thyroid, your reserves, endocrine, psychology, how much fat you have as well. The BMI is not, it's not just BMI, it's thinking about the muscle composition, reproductive tract and exercise. And on to the next slide, please. And so this is sort of any questions if you have. So we've come to the end of it. And I'll hand back over to Shirin.
Thank you. Thank you, Karen. So if you have any questions, please write them in the chat. That was fascinating, but also a little bit of a minefield.
It was a really big minefield.
It is. So I have a question first. So for people like us, you know, patients ask us all the time, what can I do to improve my chances? And, you know, like you say, now we've got a little bit more information. We can obviously guide them towards certain supplements that you put together. The Grow Baby test is quite interesting.
Yeah.
Do you recommend it to anyone who wants to sort of do better in preconception?
So yeah, I do recommend it to people who come to me with particularly a fixed timeline, like the timeline that you described, Shirin. So a little bit of an older mum who hasn't got much time in terms of getting pregnant, but wants to make sure that that pregnancy is a success, because it adds another layer on. So in medicine, we really much focus on things like clotting problems. A lot of people know about thrombophilia, phospholipid syndrome, APS, but this is a whole nother layer where you're protecting yourself against your own personalized sort of genetics in a sense, and helping to reset that so it's the best that it can be time that you get pregnant. So it's worked really well with a few of my women. It's also really interesting. It also can give you like a progesterone receptor test. So
worked really well for
yeah,
us.
worked really well. So it's not about your absolute progesterone hormonal level in your blood. It's actually about what your body does with the progesterone that's there. So you can, so with those people, I would put them on a slightly higher cyclogest or progesterone when they get pregnant. So it's really, really helpful. So I do actually recommend it. Yeah. It's not that expensive as well. It's probably like about £200 a test, and it just yields so much useful information.
Oh, fantastic. We should get into looking at getting that. So I've got some questions coming through. Thank you. The first one is, and I get asked this often, what is the optimal dose of CoQ10 for preconception? It's at least between 200 to 300 milligrams. 200 to 300. Yeah. And this is my question, not the
but sometimes it depends slightly. So that's the base level, so that's fine. But for example, if you've got somebody and you know that they've got PCOS, or they've got anything else like a cardiovascular illness, you might want to just increase it slightly.
Can you overdose on CoQ10?
Yes, you can. You can overdose on every supplement.
So what is the maximum CoQ10 that you will take?
You wouldn't usually take more than 500 unless you've got proper advice from a doctor or a functional medicine specialist.
Fantastic, thank you. Another question coming in. What is the top 3 supplements that men should focus on and the recommended dosage?
So I think definitely choline. So choline would come in at around 450 to 500 milligrams, because it's just, well, I see it as it guards the whole DNA of the sperm, so it prevents that fragmentation issue. I think CoQ10, often very missed, and it's focused with women because, as you've seen, it really links into the mitochondria. Really, really important. And then zinc is another really, really important one for the whole function of that, the sperm. It works as a cofactor for so many reactions within the sperm cell.
Fantastic. So a bit of antioxidants, a bit for mitochondria.
Exactly.
And a bit for
for all the other reactions.
Fantastic. Yeah. There is another question here that says, if you have any underlying medical conditions, what should you do before you're pregnant?
So it's really important to sit down with your, obviously with the, we have clinics around the UK which are called maternal medicine clinics, so it depends on the severity of your condition, but you should be able to have access to an obstetric physician and optimise. So you want that condition to be at least stable for 12 months before undergoing any fertility treatment or trying to get pregnant, because it means, as you can see, it will set you on the best outcome for actually getting pregnant, but also not having the complications, but also not passing on the imprint of that chronic illness onto the your baby as well, which is really, really important.
Yeah.
So for example, if somebody comes to me with type 2 diabetes, again, that's one that I love to take care of everyone with type 2 diabetes. I will start them on minoxidil, and that will be on 2 grams twice a day. I'd also make sure that their metformin is optimized, and a really careful plan about protein, together with fat pairing, to make sure that their sugars are stabilized, and really timing their exercise. They would be on a continuous home blood glucose monitor, so you watch and see what's happening to their sugars, and really make sure that you stabilise. And quite interestingly, with a few of my women that have had actually IVF, I think maybe one actually had the IVF with you, Shirin, once they go into the NHS system, everybody wants to give them insulin. But remember, insulin is almost like a sticky plaster on an underlying problem.
Yes.
So it means you're not resetting that metabolism. So therefore, that epigenetic imprint that's within you at the moment, which you can reverse to a certain extent, is still passed across to the offspring. But with that sort of strategy and a few other bits and pieces, making sure their vitamin D is optimised. Vitamin D is important for insulin release from the pancreas. They've got through those pregnancies without requiring additional insulin, but I believe being stronger afterwards as well, with good metabolic base.
Yeah, I'm really with you on that. Not just coming up with a sticky plaster, but looking into changing the imprint. So answer to that question from our side is, when we see women who've had other underlying medical conditions, we liaise with physicians. So for instance, we've got patients who may have epilepsy, may have diabetes, may have heart disease. The most important thing is not to think that you can't be pregnant, but it is to get the professional help.
That's right.
And everyone working together, right? That's the most important thing.
Definitely.
So you have to advocate for yourself, is my advice, is advocate for yourself. Ask your GP, ask your obstetrics team, ask the hospital to provide this team around you, so people look after you in a multidisciplinary manner. Questions are coming thick and fast. Thank you. For women who have autoimmune disease, which supplements are recommended, especially when taking hydroxychloroquine?
So you want to also, the omega is brilliant. I think people underestimate the power of omega. It works for so many things, but it won't work if you're taking a small dose. So ideally you need to be taking 1 to 2 grams a day minimum, because that's when you alter the immune system shift from, inflammatory and reducing it right down. The other thing, I think probiotics really important. There's been so much research that looks at specific strains that can link into autoimmune disease, that can help to switch it off. And then again, depending on your inflammatory profile, there are elements such as the NAC, because when you've got an autoimmune disease, you are more likely to get lots of cell damage and degradation. So you want to really be protecting that at the cellular level. Quercetin's another one which is really good for inflammation, and actually works well for people who've got hay fever. That's a tip for you guys for the hay fever season coming up. And then the coenzyme Q10, you want to make sure that you're protecting your ovaries, that they've got that really good mitochondrial energy. There's a whole other science that looks at the bioenergetics of a cell and mitochondrial energy, which is fascinating. But that's how sometimes the autoimmune disease affects fertility. So it's important to work out what mechanism is more dominant in your situation, so you can address the supplements appropriately.
Fantastic, thank you. Do you want a sip of water before I keep
I'm good,
going?
go for it.
Okay.
All right. Questions.
The next question is low glycemic and high protein diet preferable for fertility planning?
It is preferable to a certain extent, but if you cut the carbs too much, it can also then push up your cortisol, which can be a stress issue as well. I've learned that personally from going through the menopause. I carb restricted so much, I was giving myself hyperglycemic hot flushes, and you don't want to do that when you're going under fertility. So you just need a careful balance. And although it may seem it's maybe a bit too much, you want to sometimes be thinking about the home blood glucose monitor you put on. People do it now just for 2 weeks and work out what foods work with you. So it's not really, you're not doing it for diabetes, you're looking at what foods work well with your body, so that you can optimize those foods through the phase of your fertility journey. Yeah,
I agree with that. I think there's so many tools available to us in this day and age. So I agree, we should use those. There's another question about dosage. What is a good dose of NAC for conception?
Oh, NAC, I cannot remember the top of my head, to be honest with you.
It's in the O capsule.
So have we got the NAC there as well? I think we do not. We've actually put, we put glutathione in there. So it's 250 glutathione. Okay. I take NAC myself, but we'll have to come back to you on that. Oh, no, we're not going to let that all...
Top of the tower.
The top of the tower.
Yeah. Okay, so there's another really good question coming that says, after pregnancy is confirmed, should supplements and their doses change?
They should. That's a fantastic question. So it depends on, so for example, if I've got people on the O capsule, so this contains coenzyme Q10, which is fine. It's got 300 milligrams in here. It's got minoxidil 1 gram. That's fine for pregnancy. 100 milligrams of choline. Glutathione is fine as well, but it's got selenium at 180 micrograms. So I would say only continue this for 3 months. This will optimize you for 3 months. And then you should really be increasing your choline. It should be at least 450 to 550 milligrams. The folic acid, in some people, I increase it to 600 micrograms of folate. Actually, I use methylfolate. Also vitamin D, you might want to optimize it. So you go up to 2,000 of vitamin D. Your iron may need to be increased because lots of people are iron deficient as well. So yes, it all does need to change. It all needs to be tailored towards what condition that you're addressing.
Fantastic. All right, I can see a few dots coming in about.
But NAC is interesting. NAC has also been studied in preterm and SGA as well. That's growth restriction, sorry to use an acronym. We know that is really important for protecting the placenta. When you're looking at the metabolism, you're looking at placental decline. And we know that in babies who have IUGR, that's growth restriction, it helps to maintain and also sometimes recover that placenta. I saw an interesting talk on placental bioenergetics from a professor at Oxford, and they talked a lot about supplements that make a difference, such as glutathione and NAC and choline. Really, really interesting research.
Yeah. Fantastic.
And any thoughts about women with endometriosis, adenomyosis, nutrition and supplements?
I think it's a really brilliant question. And we know that endometriosis, I know, for example, quercetin works really well for them because for some reason, as you know, they've got a higher propensity for tissue to detach and reattach in other places. And also probiotics, really important, but really anti-inflammatory, like high-dose turmeric as well, really important in those different groups. But I know, particularly quercetin seems to work quite well with them because it might link to some of the histamine and inflammatory reactions that's happening in that environment.
Change their nutrition.
Yeah.
Particularly around gluten, their symptoms improve.
Yes, it's very, very significant. And I think it's a shame because, we learn what we learn at medical school, don't we? And we don't learn beyond that. But because we don't learn, we just say there's no evidence. But actually, if you look in a lot of nutrition journals and other areas beyond our own scientific journals that we're used to, there is a lot of evidence for these things.
How about fibroids? That's another one that people ask me about.
So fibroids, again, interestingly, NAC is another one that works against fibroids. NAC helps to shrink fibroids. So if you look at that, and it's something to do with the mitotic activity that is helping to, it helps to regulate. So out of all the ones I know, NAC is really good. And there are other things like, again, the anti-inflammatory, turmeric, high dose omega, because you're trying to get the immune system to come back into balance as well, work really well. But NAC is a really powerhouse, I think, for reproductive health. Yeah.
Are you sure you're okay for me to continue? Do you want a sip of water?
I'm okay, go for it.
I think on the back of this and your expertise, you should write a book on this so we can all flick through it. I'm struggling to contain all this.
There's so much stuff. I wasn't even sure quite how I was going to put it all together because there's so much stuff.
There's so much stuff, but I think just putting it out there actually for us to
just think differently.
Think differently.
Yeah.
Look it up.
Yeah. Definitely.
Reference it to our patients.
I know, 100%. I had I recall a gentleman that came to me with his wife. They've been trying to get pregnant for a long period of time. And he had really awful sperm fragmentation and numbers. And then with instituting this, they got pregnant within 2 months. So
it works.
Yeah, it works. Definitely works. But it takes time. As we said, the 3-month window, really important.
Yeah. So we had a talk from Dr. Sangster last month. And she, I've stolen this line, Pippa, I apologize. But she said she always tells her male patients, think yourself pregnant for the next 3 months. you're producing the sperm that is going to create a baby. So you
That's
must think yourself
100%.
pregnant. So it's just a fantastic way of reframing the mentality. So yeah, I would agree
No,
with that.
100%. And also for women and for all of us, we're often thinking about, oh, you're taking folic acid because we want to prevent neural tube defects. But we don't do much beyond that. And again, the egg is undergoing the transformation phase in that 3 months. You know, is undergoing all the mitotic activity. It's emerging.
So it is, actually there's equivalent to that as well.
Exactly.
There's a window of opportunity here.
Yeah.
Okay, lots more questions coming. What is the recommended exercise you do? Some say if you do too much cardio, that's not good as it increases cortisol and stress.
So it depends on what you're used to. It's interesting. That's a really good, clever question to whoever that came from, because I think there's a recognition that as women, we're not always kind to our bodies. And a lot of the exercise studies have been done based on men. And so we have to have the right balance of muscle training exercises with cardio. So you're correct. So in the same way, for example, I'm sure that you will tell your men not to do too much running because of the sperm fragmentation that it causes with running. Again, with women, we have to be careful. Now you know your ovaries your follicle is emerging over 3 months. So be kind to yourself. Having said that, I think exercise is such a great, it trumps so many things. I know we're talking about supplements here, but it's anti-inflammatory. It calms the brain. It improves muscle, metabolic health, when you're looking at the ovarian health and quality. So a good amount of exercise, at least 150 minutes a week, is really important. But as you and I know, occasionally we meet the women that are at the gym every day, doing HIIT every day, but you alternate it with your lovely Pilates, yoga, breath work, really vital to switch on it's powerful stuff, isn't it? The way it shifts the brain, switches on the parasympathetic nervous system and the vagus system, which actually is important also for your immune system and part of your brain and body to reset its metabolic processes. So it's not simply about feeling relaxed, it's actually a longevity hack, that's what I would say.
Fantastic. Yeah. Well, I have a personal favourite. I love Reformer Pilates. I think it ticks all those boxes.
I love Reformer Pilates,
it's relaxing great. And yet it
makes
helps you build
builds muscles at the same time.
Indeed. Okay, so there's another question about endocrine disruptors. There's a question that says, can you talk about endocrine disruptors and how important it is to both men and women?
So it's massively important. I would say that I think my life has transformed over the years by that Yuka app. And maybe we need to find that.
Yuka app.
YUKA, you scan everything. So I went, no disclaimer, and bought a very famous version of a body butter, which was organic, spent £30 on it, and then scanned it and got home. And Yuka said it was red, and I was like, oh, but it says it's organic, natural ingredients. But then you look down, because in our drive as a society to create products, we create more processing methods. We want things to last longer. And so all these little chemicals that we add in go through our skin, which is highly absorbable, as we all know. We give medication. It's the biggest organ. We give medications through the skin, and it can cause a huge problem. And then don't let me get on to period products and other things as that. We know that some of them contain lead. You and I know, as former obstetricians, gynaecologists, we give medicines in the vagina because we know it absorbs. So therefore we're putting sort of tampons and pads there, which have got chemicals on it. They are another form of endocrine disruptor. Then you come onto perfumes, you come onto hair products, deodorants, the list goes on and on just with our personalised use of products. So that really needs to be changed from the men and for the women. And then you come on to all your household things that we're using, which are not great. Gas as well, indoor air pollution, our lovely candles that we like. The list goes on and on and on. And it's something that we haven't really sat down to think. What messages and what hits are we giving our body? That's how I think of it every day in the everyday products that we use. And we just need to be really mindful, particularly when your body is now producing the next generation.
Yeah, no, I would agree with that. We listened to a talk at the latest British Fertility Society conference about environmental factors and a huge implication on male infertility, because now the sperm numbers are nosediving really in sort of the bigger population. Okay, so you talked a little bit more about endocrine disruptors. If supplements do not make any difference to sperm morphology, would you continue the supplement? So someone has used them, but actually it hasn't changed the picture. Maybe I can take this one.
Yeah,
give you a
for
bit
it.
of a
Yeah,
break.
no, go for it.
So it's really important to understand the bigger picture, right? So it's not just the supplements.
No.
So I would say, first of all, again, managing expectations. There may be underlying medical conditions that supplements alone are not going to help, right? So there is definitely, especially for sperm, there's room for hormonal treatments. And again, we had Dr. Sangster here last month. There might be a varicocele that is increasing the temperature of the testicle and therefore impacting the sperm.
That's right.
However much supplements you take, if there is a varicocele there, it's not going to change it, right? Again, you know, the temperature, so no hot baths, no cycling, or no prolonged period of cycling, no laptops on your lap. So there is a whole host of things that you will need to do alongside supplements that may change the morphology. So I think it's about your expectation of the supplement coming in the bigger picture. Many people spend lots of money on supplements, but if objectively it's not making a difference, then when do you make the decision to stop?
So first of all, you've got to make sure you're buying the right supplement. I will say, having now started the supplement brand, I'm very much aware that people are out there to make a supplement to sell it to you. So for example, ours would have 300 milligrams of CoQ10. Some people will put 50 in there. The science doesn't align. We know it's not going to make a difference. Some people will put 50 milligrams of choline in there, where actually you need 500. So it's actually really important to understand what is the evidence-based levels. Now we've got lots of AI tools that you can actually even use to scan your supplement in there and say, actually, does this fit with the science? So you know. So that's the first step that I would say. The second is getting individualized testing to understand either if you've got any micronutrient or toxin deficiencies, but also just thinking about what your own personalized needs are and genetic needs are. So for example, I'm not very good at detoxification either. And when we're not good at that, it means that you're more prone to risk of cell damage and things like cancer and aging and other problems. And so I take NAC every day. I should actually know the dose when I was asked about it. But those are the things that make a difference between taking a supplement and taking a supplement. The other thing, bugbear I'll have, is that everybody's taking collagen and they ask me about capsules. Just throw it in the bin. You might as well, I don't know, go and get a biscuit. It'll probably have more collagen in it than taking the capsule. So if you really want to take good collagen, it needs to be at least 10 grams. And unfortunately, that's 4 teaspoons. So you can't get away with just taking a little capsule. And that's when you see the real bone benefits, you see the real facial benefits, pelvic floor benefits. So it's just really understanding how the dosage links into the condition that you're trying to address.
Very good. So the answer to your question is, if the supplement is not working, it may not be the right supplement. Yes. Okay. The last question, I was going to declare it the last question, but we'll take one more as well.
Why?
There's a question that says, what's your opinion on pregnant care conception? I just don't think maybe we should comment on it. We can't comment on other brands, but you know what the answer is. You've got to recognize that if there's something that's a dominant use by people, but it can't even treat the vitamin D deficiency that's occurred within the whole of the UK, then it's a bit of an issue, isn't it? Great. Okay. Yeah. And there's a last question that has come for the both of us. So they've asked that if both of us could give our top 3 tips for women and men to optimize fertility. It's a nice one. Do you want to go first?
We can do one by one. Yeah. So, so the first one is to optimize fertility for women. That's really interesting. I think probably think about your mitochondria. So I'll go for coenzyme Q10. First, that's my one.
go give your 3. Give your 3. I'm intrigued. I don't want to disturb your flow.
Okay, so coenzyme Q10. I think probiotics are under-recognised because of the whole body effect from the microbiome. And then the third thing is just make sure you're having sex around the time you ovulate. It's probably a good idea as well. You just have sex to start off with. I suppose that's not optimising your fertility, so maybe I'm cheating on that one. But the other thing I'll add in, I do love choline. I think it's really good for endometrial receptivity. So that's 3 for women.
Choline.
Okay. And now I think about my 3 for men.
Oh gosh. Okay. So
but remember, it doesn't have to be supplements, does it? You can.
My top 3 for women, I would say. Oh goodness, I'm an IVF specialist.
I know, but
Time, I would say be mindful of time.
Yeah.
Okay, so my
that
top
was always
three,
our mantra, wasn't it? As a training.
my top
Have you-
three is time. I
Yeah.
think, you know, like I said, optimization versus time. I'll be mindful of time. I'll be mindful of menstrual cycle. So I'll be very careful about keeping a log of menstrual cycles and familiarizing myself with the menstrual cycle and the window of implantation and fertility. And I think, goodness, my third one would be having the O capsule. Have a really good supplement regime.
That's a good one.
Right, so
And
supplements,
then
menstrual cycle, and be very mindful of time. Ovarian reserve and fertility does decline from 35, so it's really important to be proactive about your fertility.
Brilliant. And then for me, on to men, top three for men. So think about your sperm quality. So I think one of the best ones, which is not used, so I will say is choline, because a lot of people talk about it, and we love seeing the difference in men's sperm quality when they're using choline. The second I will say about men is exercise. I think a lot of people think you're running, I'm really fit and healthy, or cycling, and we know that, you know, lots of jogging, extreme pressure can cause fragmentation of the sperm. And the last one might say stress. Men, you need to like maybe stress reduce, a bit of breath work, do it together with your partner as well. That helps to really create a calm environment for that baby to come through. Yeah. And then over to you,
Great.
Shirin.
So my top three advice to men, I think one would be weight. I think having a good weight is really important. There's lots of studies coming out that actually say men who are overweight have poorer sperm quality, movement, poorer fertility. I would say frequent ejaculation is really important. From where I sit, again, keep the production of sperm fresh, kickstart production of fresh sperm. How frequent? So we will say 2 to 3 times a week if you're trying for a pregnancy.
Yeah.
And before IVF, actually, again, you know, I've stolen this from Pippa, that we say actually ejaculate more frequently if there's no problems with the sperm, because the fresher sperm will have a better sort of fertilization potential.
Really clever.
And I would say be very careful of your gym supplements, actually, because I see many men coming into our consultations room looking very good, you know, lots of muscle, very fit, but actually, and they say, no, I'm definitely not taking hormones, but almost all of those gym supplements have endocrine disruptors.
They do.
And really impact
the steroids
the
and all
quality.
that stuff. We haven't talked about that, and in the waters and stuff.
So I would say, you know, continue exercising, but moderately. Make sure you know, the temperature is kept low. So I'm going beyond 3. Sorry, it's very difficult to do it in 3.
It's very difficult to go beyond 3, but it's a great 3.
And that's okay. Let's see, one more. So no more than CoQ10 600. Karen said the dose, a higher dose is. Some clinics have said you can take 600. We said any more than 500 needs to be under specific advice for CoQ10.
Yeah, I think the randomized trial, there was a trial that was 200 3 times a day.
Yeah, exactly, That's what that.
And a really good question, can you get choline in your diet at all?
You can get it from eggs, but the issue is that there was a study that was done in probably about 5 years ago in Europe, and found that 70% of people were deficient. So no matter what we're doing in terms of trying to get it through our diet, there's still quite a lot of deficiency around.
Okay.
Yeah, so that's the issue.
All right, so that takes me back to us as Fitzrovia Fertility. We are obviously delighted to look after you throughout your fertility and pregnancy journey. Karen and I work together in sort of looking after our patients. And we basically, I think, all of us will want to combine medical excellence with a personalized approach. Thank you so much for coming, Karen. This was incredibly helpful, and I think we can do more of these to sort of get your expertise on board for our patients. Thank you.
Brilliant. Thank you.
Thank you.